A pharmacist. A pharmacist and a doctor. What is the major difference between the both of them? I know that for you, anytime you hear pharmacist and doctor, you feel like they need a referee to separate the both of them, that the two professions are always fighting. They are two amazing professions. If I do not study pharmacy, what else? I will study pharmacy. There are two amazing professions. Which one is better than the other? They are both important in the health sector. Like they both play a major role. Don't forget that the major thing here is not even about the profession. For both of them to work together for a good outcome in a patient. In terms of studies and instead of school and everything, doctors are trained throughout their year to diagnose patients, to treat illnesses, everything about disease. They are experts. But a pharmacist is trained to be an expert in medicine. Anything pertaining to drugs, they are trained to know the safe use of medicines, to actually know the doses of that medication, interaction, and how your body responds to the medication, what the medication does to your body. So they are both important in their own aspect. A medical doctor is an expert diagnostician. Like they send you for lab, they send you for tests, you do all those things, you bring it for them, they interpret, they diagnose you, they tell you what is wrong with you, they counsel you based on the disease, how you can go about it. They now draft a treatment plan for you. As they prescribe those medications for you, that's when you now take it to a pharmacist. This is where you now say, only what they know is just to dispense medication, is just to count, take one daily, take two daily. No. A pharmacist looks at that prescription you've brought. A pharmacist now checks for all the drug therapy problem. Maybe drug-drug interaction, drug-food interaction, maybe the drug you are meant to take will not actually, maybe based on the condition you have, for that particular condition that made them prescribe for you, maybe the medication you are meant to take will not favor the condition you already have. It's the pharmacist's duty to outline those things, check the prescription errors, and take it back to the doctor. Counsel you on how to use your medication safely on the proper dose and when to use them. So a pharmacist is a drug expert. So stop confusing the both. Anytime you're not feeling well, yes, they can go ahead and argue, but pharmacists are the most accessible healthcare practitioners. Because in some countries, pharmacists are actually allowed to diagnose, to prescribe in some cases, not all cases. As doctors have specialties, so as pharmacy, yes. What do you mean? Yes. Because as a physician, he might be a gynecologist, an obstetrician, or he might be a pediatrician, he might be a surgeon, he might be an orthopedic doctor, he might be a radiologist, as the case may be. All these things are specialties. So as pharmacy, we have pharmacists in research, community practice, hospital pharmacists, we have organizational pharmacists, pharmacists in academia. Can they work in collaboration? They are both heroes in their spaces. A doctor is a disease expert, while a pharmacist is a medicine expert. So they both can work together, whereby a pharmacist vets a prescription. After vetting a prescription, corrects the prescription. Yes, corrects the prescription, takes it back to the doctor to make an adjustment before dispensing of that prescription. So all these things is to optimize a patient's outcome. Who do you see first when you are not feeling well? If it's a minor thing that requires you to take over the counter medication, you can see a community pharmacist. As the case may be, you can see a community pharmacist tell you, guide you on what to do. Then if the case is above that pharmacist, he or she will tell you, will refer you immediately to a doctor. That is how it is. They're not trying to take the space of doctors. There is no way. Everybody have their own division. Everybody have their own field of expertise. So why will I do that? We can every day work together. Remember that our goal is for the patient's outcome, not even for the vast boost that you are expecting. So if you are not feeling well today, and it's a minor thing, you can meet a pharmacist. A pharmacist to guide you and tell you what to do and refer you if it's something that is very, very serious. But based on the fact that you have used over-the-counter medications and you're not feeling and the symptoms is coming back, you need to go and see a doctor immediately. Or you can first of all go and see a doctor A doctor will examine you because that's what they do. They will examine you, diagnose the illness, and send you for lab when necessary. You come back with the lab results, they interpret it, they give you a prescription, they tell you to meet a pharmacist to dispense the prescription and tell you and give you guidance, counseling on what to avoid and the proper way and the safe way to use the medication. Doctors treat diseases, but pharmacists, they treat diseases with medicines. So if you found this helpful, so do not forget to subscribe to our wonderful channel, like the video, share the video, and turn on the notification button so that you'll be the very first person receiving these wonderful videos like this, not most beautiful videos like this. And I hope you enjoyed the video. See you next time.